health experts say it appears we are on track for another winter COVID wave. Although the strain spreading now doesn't appear to be as serious as previous variants, that is, the latest strain is XBB 1.5 and is spreading fast, mostly on the East Coast. The CDC says it accounts for about 40% of cases nationwide, nearly doubling since Christmas Eve.
We are seeing that new variant is accounting for about 2/3 to 3/4 of the COVID cases in New York and New England. And the expectation is, even though it's only about 1/4 of the cases here in Texas, those numbers will start to go up. And so we should expect another winter wave.
As always, health experts say the best way to protect yourself from getting very sick is to stay up to date, of course, on your vaccine shots, especially the latest booster. And with that said, I want to bring in our medical expert who can really break all of this down, Dr. David Winter from Baylor Scott & White Health, for more on this and your other health headlines. Good morning, Dr. Winter.
Good morning, Tashara. Good to be with you.
Always good to see you. Last week, we talked about COVID, RSV, and flu in America. Are we still under that threat?
Well, we are. RSV actually is declining a bit, although I've got a touch of it myself from my granddaughter, by the way. She's a little hoarse, you can tell that. But it's leveled off a bit. Flu is now, it's not peaked yet, but it's declining somewhat, but COVID's taken off, as you just heard. There's 2 new strains out there. Now, the good news about these 2 new strains, the bivalent vaccine works against these. These are descendants of the Omicron. Omicron vaccine is in that bivalent vaccine, so if you haven't gotten one of those, you might consider it because COVID is coming looking for you.
Well, I sure hope you start to feel better. Want to get to another health threat that a lot of folks are talking about these days, cardiovascular disease. It remains the leading cause of death in America. What can people do to reduce the risk?
Yeah, you know, Tashara, there's a new study that came out and said that if you're a walker, you might be protected if you walk a certain amount. Less than 2,000 steps a day, no, but 6,000 to 10,000 steps a day, yes. It lowers the risk of heart attacks and strokes by 40 to 50%. So 6,000 to 10,000. Now, you can measure the steps or time if you want to, or know that a half a mile equals 1,000 steps. So either 3 to 4,000, 5,000 steps, or 3 to 5 miles, that'll get it to you. So work on that, work on your walking. It can lower the incidence of heart attacks and strokes. And other studies have shown this, so I think this is good information.
Very good information. Another thing, one of the most common reasons to visit a doctor, folks talking about low back pain. Many people may be surprised to know poor sleep habits may be the culprit. Why is that?
Yeah, I was surprised to see this also. We know that risk factors for back pain are a physically demanding job or a sedentary job and you don't exercise, and obesity, that can increase the chance of this. But these studies found that sleep and low back pain are intertwined. Now, it makes sense. If your back hurts, you're not going to sleep well, but the reverse is also true. If you don't sleep well, you can have back pain. The authors don't talk about why this might be. They haven't figured out the reason for that, but if you have poor sleep habits, don't sleep well, if you have back pain, you ought to work on both of those because they tend to interact and heighten the bad parts of both of those kind of problems.
Oh, Dr. Renner, you're talking to someone who wakes up at 2 o'clock in the morning every day. Talk about sleep issues, my goodness. Let's switch topics. I want to get to dry January. That's a New Year's resolution to not drink alcohol during the month of January. What do you think about this resolution?
Well, I've had a lot of friends and patients who talk about this. They say when they don't drink any alcohol during the month of January, they feel better, they have more energy, they sleep better, they lose some weight, they save some money. And surveys have also shown that if you do this dry January, those folks tend to drink less for the rest of the year also. So it makes good sense. If you worry about your drinking habits, dry January is a good way to start off the new year.
Greg is standing next to me. Greg, you hear him? He said dry January. I'm just kidding. I'm kidding.
Why are you bringing me into this?
Dr. Winter, thank you so much. Appreciate you joining us this morning.
You bet. Thank you.